In 1990, Dr. Jain Video on Wheels Ltd was established to benefit the remote areas of country where living was still tough. By way of video message cards, an attempt was made to improve lives of the common man. By the help of video cards, street plays, folk dance, movies, puppet shows. Dr. Jain Video on Wheels did advertising to make the villagers aware by going and spreading it from village to village. Dr. Jain Video on Wheels is right on top by providing interpersonal communication means, that is IPC, to healthcare staff, doctors, paramedic staff, etc. by giving life-changing behavior workshops. Dr. Jain Video on Wheels also did orientation training camp for Panchayati Raj institutions and public health workers. They were trained to utilize government schemes and render benefit to rural masses. Dr. Jain Video on Wheels did telefilms for advertisement, TV serials.
मेरा कोई भाई नहीं है, कोई भाई नहीं है मेरा। मैं ही अपने बापू का बेटा हूँ। आज के बाद मैं अपने परिवार का बोझ उठाऊंगी। सुना आप लोगों ने? मैं अपने परिवार का बोझ उठाऊंगी, मैं।
Documentaries.
Welcome to Odisha, the land of peace, purity and tranquility and wondrous variety.
Docudrama.
ऐसी कोई बात नहीं है, मैं तो खुश हूँ ना, बहुत खुश। बहुत बहुत मुबारक हो बबली।
Video spots.
गंदे हाथों से अच्छा खाना भी खराब हो सकता है।
हाँ, वही जो हो साफ, सुरक्षित और सेहत के लिए सही।
And jingles for various institutions and government ministries and departments.
करे प्यार भरपूर,
बदलावों की दे सीख, उन्हें न करे अपने से दूर।
This organization made daily bulletin for Union Ministry of Rural Development.
नमस्कार, ग्रामीण भारत की विशेष कड़ी खबरें विकास की में आपका स्वागत है। सबसे पहले नजर डालते हैं आज की सुर्खियों पर। केंद्रीय ग्रामीण स्वच्छता।
This was telecast in 11 Indian languages and 22 Doordarshan stations. By Prasar Bharati and Union Ministry of Agriculture, Khabrein Kheti Ki and Mandi Bhav named two programs were entrusted to this organization.
नमस्कार, खबरें खेती की में आप सबका स्वागत है। सबसे पहले देखते हैं क्या है आज की ताजा खबर। राष्ट्रीय खाद्य सुरक्षा मिशन।
This was telecast in 11 Indian languages from 19 Doordarshan stations. Dr. Jain Video on Wheels was providing vivid social and cultural promotion and advertisements from the last 2 decades, was given to provide direct rural areas primary healthcare services in 14 rural development blocks of Madhya Pradesh with the help of hospitals on wheels. This is providing free healthcare services by trained MBBS doctors, nurses and paramedics to the lakhs of villagers in their own villages. In 2009, Dr. Jain Video on Wheels got the work of 11 districts of Uttarakhand state to provide modern hospitals on wheels, which includes automated analysis of ultrasound, ECG, patholab tests and X-rays. This hospital on wheels has on board general physician, radiologist and gynecologist with nurse, lab technician, X-ray technician, pharmacist, driver, multipurpose worker and coordinator. These moving hospitals are for early detection of disease, means to detect disease as soon as possible on primary stage and to refer to the hospitals. Like this, Bihar government also entrusted to this organization to run 12 mobile medical units on district level, and by considering the better service, they then asked 5 more moving hospitals for regional villages of Mahadalits to provide primary health care. In Bihar and Uttarakhand, these moving hospitals help detect TB, cancer, HIV, heart diseases, diabetes, anemia, dangerous female diseases in primary stages and sent them to hospitals where they were treated and were able to save their lives. Like Madhya Pradesh, Dr. Jain Video on Wheels bagged 42 MMUs in Uttar Pradesh, 30 in Chhattisgarh and 2 in Karnataka at rural block level. These were deployed in backward areas of Bundelkhand, eastern rural areas of Uttar Pradesh, whereas in Chhattisgarh, Naxalites affected areas and backward areas are benefiting from MMU services. In Bihar, 102 ambulance services is also provided by Dr. Jain Video on Wheels Ltd. By dint of this service, pregnant women, infants of 1 year of age, senior citizens, road accident people, patients from below poverty line, and patients of Kala Azar are provided services from home to hospitals through ambulances. By the help of this service, 504 ambulances are carrying more than 2,500 patients to the hospitals every day. For this, a 60-seater call center has been established in which anyone can call on toll-free number 102 and get ambulance service in every remote corner of Bihar. These ambulances operate through most modern GPS and GIS technologies and are also built on real-time online data management and voice recording system. In remote areas of Uttarakhand and Himachal Pradesh, many community healthcare centers are out of surgeons and surgical equipment facilities. Hence, many patients lost their lives. Uttarakhand and Himachal Pradesh government gave responsibility of organizing super specialty surgery camp of 7 days to perform surgery of needy patients in remote areas. This institution did hundreds of surgery to the needy patients with the help of the surgical equipments and surgeons. Ambulance services are running in almost every state of country, which provides convenience to people living in remote areas by transporting them to cities' hospitals. But if the patient dies in city hospital far away from his village, then it is quite difficult and expensive for the families to take his dead body to home. In this time of crisis, Chhattisgarh government entrusted Dr. Jain Video on Wheels Ltd. 1099 Muktanjali service to facilitate rural people to take dead bodies of their near and dear ones to their home in far-flung areas. This service provides free transportation from hospital to home with 60 Hearse vehicles. To make sure new generation is healthy and disease-free, Chhattisgarh government gave this responsibility to Dr. Jain Video on Wheels to check and give immediate treatment and refer to hospitals if needed twice in a year to 29 lakh students of class 1 to 12. For this service, almost 250 teams of doctors on roll of Dr. Jain Video on Wheels Ltd. are on the job. It is ironical that in our country, ambulance services are started by which patients are reaching hospitals, but for emergency treatment, primary healthcare center and community healthcare center, they are lacking treatment facilities. On these places, Dr. Jain Video on Wheels Ltd. is determined to provide modern services on the basis of BOT, meaning Build, Operate, Transfer. Till now, 57 public-private partnership projects were successfully operated by Dr. Jain Video on Wheels Ltd. and has now become the leading company of the country in facilitating social sector to render quality services. The chairman of this company has a mission to deliver services not only for profit but for social cause as well.